Gosh, COVID got us acting like herbalists. I can remember when the first wave came around. I didn't know anybody who had COVID. We were just hearing stories. Second wave came around, and I know 10 people, including my shop assistant. And this is the reason why I think government is struggling with Nigerians in believing, one, that there is COVID, that two, it is serious enough for us, to take cognizance of it, and three, for people to actually mask up, do social distancing, and just maintain basic hygiene protocols. So my shop assistant, after 3-4 days, manages to get to the center, NCDC, to have her samples taken. She was turned back that she was late. So she goes back with her headache, her fever, her body aches, her cough. She goes back home. Goes back on Thursday, which apparently is the next day that you can go and be tested. And she's tested, and then that's all. She just told, well, since your case is not critical, go and have a lie down, and we'll get your test to you. But in the meantime, continue taking your meds. And so I asked her, did they give you meds? And why I asked her, did they give you meds? That was being sarcastic, because we had been the ones who had sent her what we had now realized was the protocol, at least, to take care of symptoms. The vitamin C, the D, the zinc, that and the steaming, the inhalation, all that we've been doing. They didn't give her any palliatives. When you go to see a doctor and the tests are done, usually the first line doctor gives you some form of medication to help you, tide yourself over to when the results are out and they know what really is the problem. And I found it rather odd that, you would just send somebody who is clearly, in some form of distress. And this is part of the reason why Nigerians are really finding it difficult. Nothing has really changed in the healthcare system. I can remember, a little history lesson. When the missionaries came and they wanted to sell the gospel, and the nomads, one of the groups that they were working with, would not listen to them. And after investigation, the nomad said, listening to the missionaries to go on about the gospel was not their issue. What their issue was the death of their livestock, and them sometimes. But the major thing was their livestock. And hence was born the strategy to bring in doctors and veterinarians to look at the livestock, treat the livestock, and treat the human beings. And that was when they had an inroad and they listened. And fast forward to now, it's literally the same thing now. Government wants to have an inroad for people to listen to it and to take it serious, even though it is, yes, it is for our own good. But the truth is that people are at a certain point of their life and they feel that they're not being heard. Everybody that has gone through the COVID experience that I have asked has said that it was a humbling experience. But what is more humbling than losing your job at the wrongest time? What is more humbling than having to go home and tell your kids that they probably will not be able to resume school because daddy or mommy's business has gone down the pipe, or they don't have, means of subsistence? What is more humbling than being told that you need to raise money because somebody has kidnapped somebody of a loved one of yours? These are the issues that people are grappling with. What about going to the hospital and being told that, well, because you don't have enough money, we can't take care of you, or after a couple of hours, this is not the hospital you should be in, it's in another hospital. These are the real life issues that Nigerians are dealing with. And it's a cry for help. If you govern, if we see your hand in governing, then you can talk to us about wearing masks, and let us even begin to understand the statistics that you're showing us. The statistics you're showing us are not different from the numbers that are dying from bad healthcare, lack of access to healthcare, insecurity in the country, and hunger. However, it says what people are doing, that you will do to help yourself irrespective. And then, yes, while we are waiting for government to govern, steam, just hot water, cover your head, steam, so that in case you are exposed, maybe to help kill, so that you don't go, you can't afford 40K to pay for tests, and you can't afford to go Tuesdays and Thursdays and to NCDC to tell you to wait to get your result while you're going through it and being on your own meds. Steam. Join us on Diary of a Stupid Woman on our YouTube and our Instagram handle. See you next episode.